Good evening, everyone. Welcome and thank you for joining our first Healing Baltimore Webinar Series. My name is Dr. Gloria Ngeno, and I'm the Project Administrator for the Morgan State University component of the VALUE Baltimore project. Healing Baltimore is the element of VALUE Baltimore project that is designed to lead the way to a healthier Baltimore after COVID. It has 4 elements: self-care quotes provided weekly during the ambassador training, positive fun facts about Baltimore that is also provided weekly during our ambassador trainings, the social determinants of health tool that is used for referral to the Baltimore City Health Department services, and Healing Baltimore Webinar Series. The goal of these webinars is to have an opportunity to honestly discuss historical trauma in Baltimore, but more importantly, to make recommendations for how we can move to a healthier Baltimore. First, I'd like to invite Dr. Kendra McDowell, the Chief Medical Officer for the Baltimore City Health Department, to come and welcome participants and give a brief overview about the overall Baltimore versus COVID initiative. Dr. McDowell is a board-certified pediatrician and CDC-trained medical epidemiologist. She has completed the CDC's Epidemic Intelligence Service Fellowship, where she deployed and provided technical assistance for multiple domestic and international field investigations, including measles outbreak in New York and circulating vaccine-derived poliovirus outbreak in Ethiopia. She has also led the telehealth and implementation unit within the Health Systems Coordination Team in CDC's COVID-19 response structure. Welcome, Dr. McDowell.
Thank you so much, Dr. Ingino, for that introduction, and welcome everyone. I'm so happy to be here at the first Healing Baltimore webinar. As mentioned, my name is Dr. Kendra McDowell. I'm the Chief Medical Officer of the Baltimore City Health Department. I just want to welcome our VALUE peer ambassadors, partners, and community residents to the first webinar in the Healing Baltimore Webinar Series. For the last year as a city, our motto has been, it's Baltimore versus COVID, let's win this together. This model emphasizes the need for trust and unity as we work to end the pandemic in Baltimore. At the health department, we strongly desire to partner with community leaders like yourself and know that it is the only way that we can collectively achieve our goals. Back in January, early on back in January, we set a goal that at least 80% of the Baltimore City population will be vaccinated by February 2022. As of today, more than 61% of adults in the city, about 290,000 people, have had their first or single dose of the COVID-19 vaccine, and more residents are getting vaccinated every day. This is encouraging news and is a result of strong partnerships among public health, healthcare systems, providers, pharmacies, but most importantly, the residents of Baltimore City. We owe a big portion of this initiative's success to VALUE Baltimore. VALUE stands for Vaccine, Access, and Acceptance, lives in unity, education, and engagement. And the initiative works to ensure that Baltimore residents who are more vulnerable to COVID-19 and may face greater barriers to vaccination are ensured equitable access to the vaccine and transparent and accurate information about vaccination. Through VALUE, V-A-L-U-E, we bring vaccine directly to communities that have been marginalized and are underserved through mobile clinics and dozens of VALUE ambassadors. These are over 40 Baltimore City residents that are dynamic people living in your community, living in our community, that are doing direct outreach to their community. So through this work, every day our VALUE ambassadors are having one-on-one conversations about the vaccine with their peers. Laura Prever-Dum of IVAC International Vaccine Access Center at Johns Hopkins will share a little bit more information about this exciting partnership later. Healing Baltimore, the webinar series that we are on in this new initiative that we are embarking on today, is an initiative of the VALUE Baltimore and is designed to help us see and work toward a healthier Baltimore for all of our residents after COVID-19. Dr. Gloria Ingino of Morgan State University will share more information about Healing Baltimore in just a few minutes. Tonight, Dr. Kim Sidnor, Dean of the School of Community Health and Policy, Morgan State University, will be speaking on health inequities. This webinar series will begin a conversation about building a healthier Baltimore. While past trauma will be explored in this series, but more importantly is that our speakers will be making recommendations to move us toward meaningful change. This is a series about building hope and trust within our city. I invite you to please mark your calendars to attend each webinar in this series and be an active participant in the work moving us to a healthier Baltimore. I want to say, lastly, the health department is extremely grateful for the work of Morgan State University in leading this Healing Baltimore work and Dr. Bronner, and also IVAC and Lois Prever-Dumb in the work around our value communities work. So thank you for bringing this opportunity for us to move forward together as a community. Thank you all.
Thank you, Dr. McDowell. Next, I would like to invite Lois Prever-Dumb to come and give a brief overview of the VALUE Baltimore project. Lois is the principal investigator for the VALUE Baltimore project, and she's also the senior advisor of policy, advocacy, and communications, and director of adult immunizations at International Vaccine Access Center, that is IVAC, at Johns Hopkins. More recently, she has focused on community engagement and vaccine acceptance in older minority populations in Baltimore City and preparation for COVID-19 vaccines in both the US and globally. Welcome, Lois.
Thank you so much. And I'm so excited to be here to talk about the VALUE Baltimore project and the wonderful partners and ambassadors and people of Baltimore that have really been working together to make all of this happen. And Dr. McDowell talked a little bit about VALUE Baltimore already, giving you the title, which is Vaccine Acceptance and Access Lives in Unity, Education, and Engagement. And it's amazing how each one of these words has meaning. And these are all things that are going to lead to greater trust, hopefully healing, unity, and people accepting and being able to receive the vaccine. So we're very proud to be working with our partners at the Baltimore City Health Department, the other team at the International Vaccine Access Center, Morgan State University, who's been overseeing the efforts of the ambassadors out in the field and the ambassadors themselves, as well as our wonderful partners at MICA, who really have been listening to the community and helping create the messages and materials that are so important to each community. So if you could go to the next slide, please. So just to give you a little bit of background about what this project is all about, it starts with listening and understanding the needs of the community. Because, if we expect people to, go out and access vaccines, we need to have a good understanding of what are the people's concerns, what are their challenges that they have, so we can create a program that meets people where they are. We want to co-create COVID-19 vaccine education programs, and this is what the VALUE peer ambassadors are going out and doing. They're implementing, going out into the communities where they're known and respected to educate, engage other community members, and most importantly, build trust. And then throughout all of this, we want to be able to document what's happening, because this is just such an important effort, not only in Baltimore, but around the country as a model for the rest of the country. Being able to use people in the community to talk to others and be able to increase the communication to enable people to make their informed decisions about COVID-19 vaccines. So at the end of the project, we hope that the project will actually not end, but continue on into other public health needs and build engagement throughout the community. Next slide, please. So as Dr. McDowell indicated, the VALUE project is part of a bigger Baltimore City Health Department strategy. And the place that we're focusing is really on the 10% of Baltimore residents, where we call them the VALUE communities. This is where we get out and meet them where they are to ensure that the communities can receive the vaccine. We hope that by February of 2022, that 80% of all the residents will be vaccinated with COVID-19. Next slide, please. And then in terms of communication, this is part of a further communication campaign, Baltimore versus COVID, as Dr. McDowell explained. Not just mass media is important, or the providers, but where this program fits is in really building trust through our ambassadors and through engagement in the communities. Next slide, please. So you can see here, there's a variety of different communities that we're reaching. There's a lot of overlap between communities, but they all have unique needs, and being able to understand those needs is critical to the success. Next slide. And this success really would not happen to the ambassadors, many of whom are here today, to really make this all happen. So we look forward and into being able to move forward and taking the most important step, which is building trust. And the Healing Baltimore program is one that will demonstrate how this can happen, starting with an understanding of the history that Baltimore has gone through and the needs that we have to go forward. So thank you for your attention, and I'm really excited to hear from Dr. Sidnor, and we'll look forward to the success of all of us in Baltimore. Thank you.
Thank you, Lois. Now I would like to take this opportunity to welcome our guest speaker, Dr. Kim Sidnor. Dr. Sidnor is the Dean for the School of Community Health and Policy. She is also the Director of the Center of Urban Health Equity at Morgan State, which was made possible through the funds received from philanthropist Mackenzie Scott and was maintained by way of annual $3 million appropriation from the state of Maryland to the university's operational budget. Morgan State dedicated $500,000 from the historic gift from Scott to get the new center started. Dr. Sidnor was also the site director for the W.K. Kellogg Health Scholars Program, located in the community-based participatory research track. Dr. Sidnor has done research in a number of areas, but her current focus is on child development and Maryland courts. She is broadly interested in the social determinants of health. In addition, Dr. Sidnor helps to build the next generation of public health leaders through mentoring as an active member of the Phi Beta Kappa Honor Society. Welcome, Dr. Sidnor, and you're welcome to share your screen as well. Thank you.
Thank you, Dr. Ngano. And okay, I can't share just quite yet, but somebody has to release so I can upload. Okay, here we go. Anyway, good evening, everyone. Is it evening already? You know how the days fly by. I'm going to start with uploading my slide. Again, introduce myself, Kim Dobson, and tonight in particular, I need to emphasize my maiden name, Kim Dobson Sidnor. As Dr. Ngano noted, Dean of the School of Community Health and Policy, where we have nursing, nutritional science, and public health housed within our school. Also director of the newly formed Center for Urban Health Equity, something we're particularly excited about and which helps frame, I guess, why I have expertise to cover this topic of understanding health equities. And my particular focus is going to be on Baltimore. I am a Baltimorean, I'm a native. So I think this is both a personal and an academic opportunity for me to have this discussion. It's a convergence of many aspects of my life. I got my degree from Morgan State in psychology. I got my doctorate from Hopkins in public health. And I think this presentation is going to give me a chance to blend together the many aspects of my life in ways that I have not done before. So I hope as a value proposition that everyone on the call finds this to be valuable, interesting, hopefully always uplifting, and meeting the goals and the agenda of the work. So by training, I am a public health practitioner, and I always like to set the stage and not assume anything. So I want to make sure when I talk about health that people know what that frame of reference really is. So health is, as you can read, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Key here is health is not about not being sick. So often we just kind of frame our health in terms of, well, I don't have this, or I don't have that, or I have this and I don't have that. The reality is we are built to be healthy human beings outside the scope of a medical office. And the World Health Organization understands this context, and we want to make sure that all aspects of our living are good, our physical well-being, mental, and our social well-being. We don't often think about that as being part of what we think of being healthy people and healthy communities. Now, public health, on the other hand, and this is sort of the inside joke in my family, because they forever thought that my degree was still in psychology and that I was somehow a psychologist. And I kept trying to tell them, no, I have a degree in public health. And they didn't get it until COVID came along. And I think they all get it a lot better. Unfortunately, COVID has educated the entire public about what public health is. And so I'm borrowing from the American Public Health Association's definition of public health. And I included it is an open system because there's so many people who are part of what makes public health that promotes and protects the health of people and communities, particularly where they live, learn, work, and play. Stay focused on those last 4 words, because those 4 words are what make the bridge between public health and then the discussion you have probably heard of and we often have about the social determinants of health. So as noted, those things are where we live, work, and play. And some may not understand it, but they affect a wide range of health and quality of life risk and outcomes. So we're a very individualistic society for the most part, and we always give out the great messages. I know Dr. Rana always is giving me the great messages about eating correctly, exercising, making sure that we get out and engage, all these things that are individual behaviors, and they are important. Every last single one of those things we individually must do. But from a public health or population perspective, we also have to be clear and understand that there are things in our environment, both literally and figuratively, that influence our overall health and well-being. And it is these things that we've just kind of focused on and understand. There's a lot of research in this realm. I know I've had students when I've taught this course as an introductory master's course, the first pushback I get is, I am the captain of my ship. I determine my fate. What I do means everything, and I don't believe in these things. Well, fortunately, belief is not what is required here. It's the data and the evidence. And the evidence is pretty clear that these influences about where we live, about how and where we learn, what we learn, about our work environment, and if we have work, and where we have opportunity to play and recreate, really do influence many aspects of our physical, mental, and social well-being. And unfortunately, and probably not a surprise to anyone, the social determinants of health do not have equal nor equitable distribution, and they are linked to power in its many forms. When I talk about power, I'm not talking about the individual power inherent in each and every one of us. We have that to control. But I think we all know that power comes from money, power comes from credentials, power comes from institutions, power comes from where we live, who we affiliate with. All those things are not equally distributed, and they are part of what makes us the social determinants of health. and therefore what influences population health. And unfortunately, even more unfortunate is the fact that they have a pattern. So the unequal distribution is not random. They're based on race, ethnicity, and geographic location, which are really tightly woven into the health of communities. And anybody from Baltimore knows that we sort of live off our neighborhoods. So the neighborhoods we're talking about are highly influenced by these inequities in the way these resources and power do get distributed. Some of the work of a major entity, the Kaiser Family Foundation, some of you may have heard about it. They've given us really nice work and visualization on health disparities and how they're driven by these social and economic inequities. And these inequities, in fact, are parts of our social determinants. So things like economic stability, employment, income, expenses, debt, medical.
I like how it's making.
Yeah, I think somebody's got to mute. Thanks. Our neighborhood and physical environment, housing, transportation, parks. We don't usually think about these things as influencing our health or being determined by anything other than our own grit and effort. But in fact, they do have a particular pattern that's based on race and discrimination. And this is nationally and globally, as a matter of fact. Education, food, community safety, social context, healthcare system. Really, you could load this up with even more information. The key point is they all influence mortality, when we die, how we die, morbidity, our life expectancy, how long we live, the cost of healthcare, our health status overall, that's both in an objective way and an individualized perceived way, and our functional limitations. And there is data and empirical evidence to support that. But tonight's really not all about the data. It really is all about Baltimore. And so I want to take a moment to shift from my usual big picture framing of social determinants of health and move into something I know even better. Our own fair city of Baltimore, which has become Baltimore metropolitan and expanded over the time since I was a kid. And so I really want to take us there. And in particular, I'm going to take us back to 1937. Now, I was not born in 1937, just to be clear. But luckily, we have records and information that far back that are relevant. And one of the things that comes out of 1937 is the fact that there was a strategy assisted by the federal government about who could borrow money for housing and where they could live. So if you all can see this map, and I hope you can, it is a picture of Baltimore back in 1937. And that key code is a color code for where should we put and invest our dollars? Where are we willing to lend and give mortgages? And I think, as everybody knows, the way we generate wealth for a number of people is the ability to acquire real estate, land, and our homes. And it's also the way we build intergenerational wealth. So you can imagine what happens when there is an intervention to determine what you can buy and where you can live. And so I want to make a note of this particular commentary on Druid Hill. And this is an area some of you may be familiar with. I certainly am. And here's what they had to say about Druid Hill and its detrimental features. One, obsolescence, meaning it had some older housing stock. But two, the Negro encroachment. So while it had a great park and good transportation, its downside was the fact that there were too many people of color located in those territories. This is explicitly a racist frame for how to distribute resources. It was not just African Americans, there were other ethnic groups, a lot of migration going on in Baltimore City at the time. So everybody who was not considered to be appropriate would have been in those categories of red and yellow, in places where you did not want to invest and should not invest. And people were literally moved about and organized based on these designations. This work is really well documented in a book called The Black Butterfly by a former faculty member at Morgan State, Dr. Lawrence Brown, who's also currently now a member of our Center for Urban Health Equity. And there's a name for what happened back in 1937. And it didn't just happen in Baltimore, it happened in urban centers all over the country, and it's called redlining. So it's a practice where the terms and availability for banks were systematically distributed or denied based on race. And over time, this policy here in Baltimore literally has led to a visualization of Baltimore that carves it up into the black butterfly and the white L, which is the way that Dr. Brown and others have seen it and visualized it. And you can see, I think, from his book cover, the wings of the butterfly and that centerpiece, which forms an L. This is not just a theoretical concept. Again, unfortunately, here are current day pictures. I think if we looked on our right, it's my right, so I'm not sure what side it is for you. It should be your right. Here's a map of density of African Americans in Baltimore City. I think if you see the shadow and the coloring, the deeper color are where African Americans have highest populations. If you look at that image, it looks a lot like the 1937 map with some modifications, and that black butterfly and white L persists there. And we can name some of these neighborhoods. Greater Roland Park, Inner Harbor, Federal Hill, they're in the L, in the black butterfly on the west side, Forest Park, an area I know, Greater Mondawmin, on the east side, Bel Air, Edison, Clifton, Madison East End, Greenmount East, are communities with high density of African Americans. Now, let me be clear about what I'm not saying, that where Black people are concentrated, it's a terrible thing in and of itself. But where there is an effort to create this concentration and also under-resource these areas, that is where the problem lies. And if you look at the map to the left, it's a map that was drawn up by Dr. Brown and students actually at Morgan State and members of University of Maryland School of Law to show the distribution of power in Baltimore City based on housing, wealth, political connections, a number of factors. And I've given you the website where you can go check out more. You can see that same, the red is, I don't think I have to tell anybody on the line what red represents and what green represents. And you can see these two maps mirror each other in very uncomfortable and regrettable ways, and they mirror back to 1937. So this is work. This is Baltimore's history. It's a history that cannot, should not be denied. We need to talk about it, understand it, and as part of Healing Baltimore, put these things on the table and work our way through making things more equitable, not equal, but more equitable, particularly in the communities that were targeted historically to be under-resourced and set to the side. But I also don't want to leave you with the impression that nothing was going on in the universe between 1937 and until now. And in fact, communities of color, other ethnic groups have continued to, always have, and I think always will, continue to work in the face of and against all odds to bring services, well-being to communities in which we are clustered. And so I'm going to show you a picture, and Dr. Rana should be happy. I'm wondering if anybody knows what this picture is, you can type it in the chat. I think mics are closed. But this is a picture of a particular building in Baltimore City. It's one I'm familiar with, though this is not its final, this is not the final building in which this institution rested, but it was one of its earlier ones. And if anybody's guessed it right, Dr. Rana, you can maybe give them an extra something. I don't know, find out if anybody typed the right answer in, but this is indeed Provident Hospital. What's unique about Provident Hospital, it was an all-Black medical facility in the late 19th and 20th century, so 1800s, 1900s, because African Americans were not allowed or had limited access to medical institutions in the area. And the hospital was a place where Black physicians, it says Negro appropriately, that was the language then, could practice their craft, bring their patients. And then the ladies, when I was reading these pieces, and I was like, oh my goodness, we've got so many issues here. But where the ladies from who were nurses could become, could get training and become nurses through these affiliated schools. So Provident Hospital was a very powerful, necessary institution in our communities, serving Black patients when others could not, would not. Unfortunately, Provident Hospital is not with us today. It collapsed under financial strain when this comment here from the director of Howard University in an article back in 1985 talks about integration and the impact of integration on Black hospitals, not just Provident, but other, and their ability to thrive and survive in the face of individuals moving and making use of other hospital facilities that were better equipped, really leaving behind those who could not pay or could not have access to these other institutions. And under the weight of that, Provident Hospital, after a major fight and efforts, succumbed and is no longer with us today. Its remnants are on Liberty Heights. If anybody knows that neighborhood at all, Liberty Heights, right below Baltimore City Community College, that lot was once where Provident Hospital's more modern campus was, and then it was later sold, I understand, to Baltimore City Community College, and I think their elder homes and other properties still there. Just want to emphasize here that there were folks at work doing things to counter some of these effects, that people did organize, galvanize to improve the lives and health and well-being of communities of color. Even that far back, this has been an issue that remains at the forefront today, unfortunately. And I want to make another side note, and this is personal about integration. I was a bused student, so I was one of the first, I think, groups of students. Yes, I'm old enough, in case anybody thought I was younger, to have been bused, right? And I remember the argument in my house was my father's like, I don't want her bused. And my mother, who was a school teacher, is like, well, I want her to be bused. And he's like, there's nothing wrong with our local schools and staying in our communities, and we have great teachers, which was true. But my mother was like, well, they have more resources, they have more opportunity, and the world is bigger than the space we live in, and I want her to be bused. So I was part of that desegregation and busing movement. And I have to say, it was quite an experience as a young kid going into the all-white school. And I think there were only two of us in our class. It was quite an experience and an adjustment, but the world certainly opened up wider. I got to know a diverse group of people. This happened to be a Jewish elementary school. So I got to learn a lot about Jewish culture and holidays and all those things. And obviously we all learned that we're all just human at the end of that process. So, but desegregation, integration comes at a price. We need to understand what that price is, look at ways we can mitigate when we attempt to make these efforts to diversify, integrate, whatever language we want to use in these particular communities. Words like gentrification look like integration, desegregation, but we need to understand the follow-up and the impact of that happening and mitigate against its less desirable effects as we work to benefit from the desirable effects. So along with Provident Hospital, back in the 60s, after the riots or during the riots, civil rights movement, there were a group of people in Baltimore City, and I'm gonna have a hard time getting through this next slide, who, sorry, I know all these people.
We are here for you. We have your back and we support you.
This is why we wanted you to come, so that you could tell us the real story.
Come on, babe.
I didn't think it would be this hard.
We can get through it. Come on, we can get through it.
Yeah.
Anyway, I know all the men on this photo. Two of them are still living. One's my father. Sorry.
It's okay, Kim.
And one is my uncle. And the rest of them were like uncles to us in our family growing up. They felt like ordinary people to us, but it turns out these were ordinary people doing very extraordinary things for Baltimore City. So Vernon Dobson, my dad, Frank Father Williams, Judge Joseph Howard, Gus Adair, who was actually faculty at Morgan State, Marion Bascom, pastor of Douglas Memorial, Wendell Phillips, Perrin Mitchell, you know him, Harold Dobson, my uncle, Homer Favor, faculty at Morgan State, Lalit Gadia, an attorney, and then Pat Scott, an artist. They were collectively known as the Goon Squad. So they were Goon Squad, and I think this is how the story goes, at least how Pat told it, because they were considered thugs in the city who would go around basically terrorizing and causing trouble. Well, the trouble they were causing was the kind of trouble John Lewis would have described as good trouble. And out of the work and efforts of this group of men, ministers, lawyers, politicians, came some very influential outcomes that resonate today. One is the Maryland Food Bank. Folks are familiar, I think, with that. And that work came out of the collective work of the Goon Squad. The Baltimoreans United in Leadership Development, BUILD, that is here today. Arnie Graff was another member, not a member of the Goon Squad, but certainly critical into the work of creating BUILD here. Folks may not know that this group actually got elected. Our first Black congressman from the 7th District, Perrin J. Mitchell. Kwesi Mfume is our current congressman in this position, but Perrin Mitchell was the first. And I literally remember my father and uncle making us get out on the bus, on the train, going around campaigning for Perrin in his first go round, and the level of excitement when he achieved that win. It was major and took a lot of work and effort. And then the last is that they collectively, this group strategized to get elected the first Black associate judge of the Supreme Bench, Baltimore City, Judge Joseph Howard. These are just a few of the things that are known about the work that they collectively did. And they were men with egos. You know, there are no women in this bunch. I can't say that they were not chauvinists. They were men of their times, but they got the work done. And when my father passed away, I think the thing that was most astonishing to me, I knew some of the things they'd done, but the number of people who came and said, because of your father and the Goon Squad, I got a job in the post office. And you have to remember the post office and these kind of jobs were the cream of the crop kind of jobs where Black people just were not getting, because the pay was good, benefits were great. And they broke barriers in many places throughout the city so that others would have this opportunity, so that these social determinants of health that have been so widely unequally distributed would be more equitably distributed. Again, they're not the only people. These are the people I know personally and can speak to and about in a very, very personal way, as I just did. So I hope you all forgive me for that moment, but I'm always moved by seeing the work and the effort of these people, because they were real and personal to me, and yet they meant a whole lot to a lot of people in Baltimore City. And I think their work still remains. But we don't have to end with the Goon Squad. I think that's the good news for us, is that it doesn't end here, right? Our possibilities for the present and the future remain strong. So this is the quote that was taken after the Freddie Gray breakout. The notion that activism is not dead, it's just taken on a different look. Back in that era, these were a group of men who literally just met together for lunch and hung out. They didn't have a formal organization. There were no bylaws. They'd have lunch at the, help me Sandra, I think it was the Belvedere, where they go and have lunch, or they go fishing together. But out of that coming together came this work. But nowadays we've got social media. We've got women, thank heavens. We've got, you know, cross generations. We got different ages. We've got folks from all over the place who can come together to do this work of activism, a whole network and communities who are I think somebody's got a bleed. But in any case, the nature of activism has changed. But when we talk about a healing Baltimore and a healthier Baltimore, the work lies in this kind of activism, and the acknowledgement and understanding that it's each and every one of us who have a role to play in our futures. It's not a moment to stand back and watch other people do. It is a moment in time for all of us to step up and do what we can do with our individual power to make it collective power and possibility for Baltimore City. And literally this is happening all over the country. And we need to be part of that movement and effort. And it's important from the Baltimore, but it's even more important when we talk about our health indicators, because we're not going to shift, again, from a public health perspective, we are not going to shift that data that says people of color are always at the bottom of the health rung until we get this activism and make these other moves. So the work is critical and necessary, and not just a feel-good moment. And we need many partners in this work and effort. One group I just want to highlight, there are millions, so I did not begin to try to list a bunch of people, But I do want to lift the work of the Family League under the leadership of its executive director, Damon Millard, who just recently commissioned Morgan, I think for the first time, included a Black institution in its assessment of communities for the work that they do. For those who don't know Family League, it is a derivative of from state funding that works on child health issues. And they created this report, allowed us to create a report using a health equity lens for the first time. So I would recommend the report to you. It's publicly available. They concentrated on particular communities where they have investments and relationships and networks. But I think the key thing to understand about Family League is how they look at the work. I mean, if you look at these domains, health, education, community, all focused on children, families, communities, to make sure that these indicators improve, because by improving these indicators, they know they are improving children and family health, and therefore improving community health. And I think this is the lens, the equity lens, and the approach that we all collectively need to take, no matter what space we're working in to get this done. We all have a role and a part to play in making this happen. So I am not an artist, but I attempt to do my word cloud for all you young folks on the line who are laughing at my attempts. Just forgive me. But I want the message to be clear. We do have a commitment to a healthy Baltimore, all of us collectively. You cannot have that without the power of you and the power of us. We cannot have it without having equity, social justice, and common ground be at the forefront of the work that we all do. We cannot have it if we don't understand the social determinants of health, employment, community health, wealth, income, education, so critical, mental health, physical health. And for Baltimore, there's no way you do this without acknowledging and understanding we live in neighborhoods and communities. So I've just named a few. So everybody on the line who is in a community that's not listed, forgive me, this was not omission, but me just trying to balance the visual and making sure I had east side, west side, north side, south side, at least presented in some way, shape, or form on this mapping. But this cloud, for me, says it all. We're all in this thing together. We've all got work to do. And now for the last slide, I'm going to revert back to my role as the Dean of the School of Community Health and Policy and the Director for the Center for Urban Health Equity that was just funded. Here within the center, we are focused on action-oriented research and practice, meaning everything we do is not theoretical. The work, the effort, the commitment is about being able to take research and have it immediately apply and translate to some benefit for communities and for the city. It is an asset-based, community-driven agenda, meaning that the work we do is going to be coming from and on behalf of communities and not our own individual sort of academic interests. And then the third piece is we are going to do our best to be good stewards and good partners to collaborate and coordinate around all this work and to be a coordinating body so that all these groups in Baltimore City, and they're from grassroots to the most high-powered among us, we all work together to understand what health equity is and build a framework and a strategy for having that happen. And with that, I say thank you, and I appreciate your time.